Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. Thank you so much for joining me. I really appreciate it. This is episode number 615, and today we're celebrating the fact that my office has won the Consumer's Choice Award 10 years in a row. I'm just looking down at my notes, and I put down, apparently I wrote 10 years in a road, but I meant to say 10 years in a row. I just noticed that. Anyway, and I have an announcement for my WQIO, my Super Q listeners. While the show is going to continue in Columbus, counting this one, there will only be 4 more episodes that air in your area. So I'm really sorry about that. If you've come to love the show and are going to miss it, you will still be able to access it at thereasonswesmile.com, as well as if you happen to be in Columbus on 94.7 FM. So today starts a 4-week countdown, episode number 615 today, and there will be 3 more episodes after this in 3 consecutive weeks, episodes number 616, 617, and the last one that will air in your area is 618. Hey, before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko, and if you'd please go to my office Facebook page and like us, that would be awesome. Also, all past episodes, complete with video, are available at thereasonswesmile.com. And so, yeah, we learned about winning the award back in, I want to say, February, March, something like that. And maybe you can tell this show doesn't necessarily be used as a vehicle to toot our own horns, We don't necessarily give out our own phone number. It's trying to bring you good dental health information, sometimes in a fun way by having guests. Sometimes the topic has not a lot to do with dentistry, but it's something that people are doing that brings smiles to a lot of folks. So I hesitate to do it, but then I thought, you know what, 10 years in a row, that's pretty darn good. And I was on Daytime Columbus a couple days ago, being honored for being a winner. And so I thought, you know what, let's just make this Sunday show about that. So, before I forget, let me remind you, you're going to have a chance to win free flowers from DeSantis Florist. That'll happen in about 10 minutes. And so if you want to pre-program the phone number into your phone, it's 614-459-9769, 614-459-9769. And so just be ready, because we try to make the question easy so that the answer is obvious, and you can just kind of win some free flowers, which I've been hearing are awesome flowers that DeSantis puts together for us. Okay, so I think what we want to do first is we're going to listen to the link to when I was on Daytime Columbus a couple days ago.
Well, it's often said, nothing you wear is more important than your smile. So if you've been questioning how you can improve yours, our next guest has the answers. Dr. Brian Kvitko of Dr. Kvitko and Associates has been awarded the Consumer's Choice Award from 2009 to 2018. He joins us now with the many ways that you can make your smile more beautiful. Thank you for joining us.
Thanks for having me.
Congratulations on the Consumer's Choice Award. What does that mean for you to earn that award so many years?
I know. No, it means a lot because people don't necessarily think of dentist and something they like. Mm-hmm. So to know that even though I'm a dentist, people were saying nice things or have been saying nice things is really rewarding.
And that's wonderful. So first off, let's get into some of the services you can provide. If you have a patient who hasn't been to the dentist in a while, might be a little nervous, you offer a service called sedation dentistry.
Right. I've been doing sedation since 1985, and we offer something as simple as laughing gas, which would be like having a couple of beers, oral sedation, which is tablets that you swallow, which would be like La La Land, IV sedation, which is wake me up when it's over.
Sure, that's what I would go for, yes. So now if a patient has maybe discolored or chipped teeth, might have some missing, what can you offer them?
Well, besides if they're discolored, we do porcelain veneers. That will allow us to, it's like fake fingernails for teeth. We can put anything, we can just make it look gorgeous and it looks natural. I don't know if we have any examples or not, but I think we might. And so, yeah, crooked, undersized, oversized, rounded edges, squared, we can change all that and make it gorgeous.
Sure, here we've got a
there we
picture
go.
here,
Okay,
yes.
so see the gap was closed in and the front 4 teeth are the only teeth that we did. We first moved them orthodontically a little bit, brought the front 2 teeth together. Of course, that creates a gap on the other side of those teeth. And then we put porcelain veneers on the front 4. So if you hadn't seen the left picture, you wouldn't know that
Sure.
that person, had that, right?
That is great. And you also offer the 6-month smile
Yes.
makeover.
Yeah, well, 6-month smiles it's called, which is orthodontics basically, but it's done in 6 months. Most of our cases take about 4 months, 4.5. And I think every adult would like straight teeth, but no adult wants to have braces for 2 or 3 years, right?
Sure,
So when we show people what we can do, see that's like 5 months.
sure. So that's the
something like-
progression over the 6-month period?
Well, the top is the before and the bottom is the after from different views. So we're able to take somebody and give them a gorgeous smile, and we didn't have to do any veneers or anything on that smile. We just whitened it and straightened them. So it's hard to believe. People don't believe you can do it so fast. They're always asking, how do you do it so fast? Well, look at that one. That one, besides bringing those front 2 teeth out and the other 2 back a little bit, I also did some tissue contouring of the gums and made it look just the way you would expect. So,
Sure.
And again, that was about 4.5 months for that.
4.5 months,
Yeah.
really? Wow.
Yeah.
So it doesn't take that much time if somebody thinks it might be really long, like
Right.
the 2 years in braces.
Right. I think anybody could put up with that for just 4 to 6 months.
Sure. So now if you have a patient who suffers from tooth sensitivity, from exposed roots, you offer gum grafts.
Yes. Now it's not just for sensitivity, but that's one of the reasons we do it. Gum grafts can be. You see, when you have recession, the root now is exposed, and the root is covered with cementum, not enamel. And cementum doesn't resist tooth decay like enamel does, and so you can get decay at the gum line of your teeth. That's not good. You can also lose the gum, and the gum is there to provide protection to the teeth and keep the bacteria from getting down between the outside world and the inside of your jawbone. So if you don't have gum there or enough, that's what happens, and you can actually lose teeth. So it's physiologic and cosmetic that we're doing it for.
Oh, sure. Definitely important. And something else you've often dealt with, a benign bone growth in the mouth.
Oh yeah, this
How
is
common is that?
interesting. It's pretty common. I just did another one. These people don't even realize that not everyone has these. There are these lumps, usually on the roof of the mouth, a big glob of something, right? It's hard. See that on the side there to the left?
Sure.
All that is bone covered by gum, and it actually was so big it was making the sides of her cheek protrude out.
Wow.
On both sides. The left is before and the right is after. I actually have a picture. I hope it doesn't gross people out, but I took a picture of me taking it off. I think that might be coming up. And so close your eyes if you don't like seeing.
I think we
Did you guys
took that
pull that?
away. We
Okay.
took that away because it was pretty gross. We were looking at it with my producer Julia too, and we said, "Ooh, that might be a little too much for the viewers."
We weren't sure, but anyway, I thought it would be fun. Maybe I'm not affected by that kind of thing. Anyway, so
It's
yeah,
Halloween blood and gore, but I was like, "Ooh, that's a little."
that's fine. That's fine. So anyway, yeah, and so it can be an issue when you're trying to get x-rays. If you have this big glob of bone on the side, it's called a torus. Well, you can't put the x-ray in and it hurts. Or sometimes your tongue is confined because you've got this bone growing almost to the middle. In the case of that woman, it was making her cheeks stick out, And most people don't know that it's not normal because they grew up that way.
Sure.
So if you're one of those people that has that, I can tell you it's not normal and it can be dealt with. And it's pretty simple. It's really simple. You don't have to be sedated, but we can sedate you if you want to be.
Sure. And I think we've got pictures of the veneers then next
okay.
to
Veneers?
or the dentures.
Oh, let's see. We'll have to see. So anyway, there you go. Okay, this is implants.
Oh, the implants, yes.
So this person had no teeth at all. I placed 2 implants. You can just see the little buttons there. And then what we did is we put the abutments on. Those are the implant with the cover screws. Then we put the abutments on. Then we put a bridge on that. And our bridge had little rings on the back. And so that would allow the partial denture that's removable to snap in. And you don't see any clasp. So this is a little bit less, there's the before and the after. That's a little bit less expensive way to do implants. If somebody wants implants but they can't afford a whole mouthful, well, with just 2, I was able to do that for her upper. You see what that upper smile looks like. Isn't that cool?
That's absolutely
Kind of
beautiful.
changed her, didn't it?
Yes, exactly. And are you accepting new patients?
Oh, yes. Yeah, we're always accepting new patients. Here's the reason, because people have asked me about that. if I'm doing my job right, then I get you healthy. And all you need is a cleaning twice a year, every 6 months or so, right? Maybe an occasional little cavity here and there. So by doing our job right, we kind of need you to send your friends and family, you know? And so we always are accepting new patients, and we treat everybody like gold, and we do our best to make sure everybody's comfortable. And it's just a fun transition from people coming in nervous, and you can see them going from almost a curmudgeon, like standoffish, right, because they're afraid, they've been hurt, to within just a few visits, sometimes just one, they're like all relaxed, and they tell us how we made them feel at ease. So.
Well, wonderful. drkvitko.com. The information is on your screen for our viewers to contact you. Thank you.
Okay, so that was pretty cool. I had a lot of fun. I want to thank Audrey Hassan. And of course, what they didn't, they cut it off at the end a little bit. Not the station, but when we did this edit of the audio, I wanted to, I congratulated Audrey for her new position there at NBC4, getting to do this daytime Columbus show. She no longer will be doing the sports, and I know that yesterday she was able to watch the OSU football game at home with friends and family, rather than being on the sidelines getting drenched or in the press box. So anyway, yeah, so just to recap, some of the reasons that we think that we keep winning the Consumer's Choice Award is that we, and these are the things you're going to have to remember for Dr. Kvitko's question of the day, is we treat people like gold. We treat everybody like gold. Doesn't matter what you look like, what it looks like you can afford, nothing matters other than you're a person that we want to take great care of and give you the best care that we can get, or that you can receive. And so we treat everybody like gold. The other one would be that we make sure that people are comfortable no matter what. Okay? Doesn't matter what that takes. If it takes an extra injection, if it takes an extra 3, if it takes a different injection, if it takes nitrous oxide, if it takes oral sedation like we were talking about, mixed with laughing gas, or if it takes intravenous sedation, we do that because we want you to come back. We want you to send your friends and family. And I'm pretty sure you won't do that if we don't take great care of you, right? So, and then the other thing that we feel is a reason that we keep winning is because we provide top-notch care. So we want to provide the absolute best care that's available for the for the time period we're in. So the care we're providing today is slightly different than what we were delivering 10 years ago. You know, because of all of the technology that's been out there. In fact, 6-month smiles didn't exist 10 years ago, so we weren't doing it. Well, wait, yeah, let me think. That was 2007. Oh, I guess it did, about 12 years ago. So, but you know what I mean. So we keep updating as things come about, and we're kind of on the ahead of the curve on that. We're not the first one to do anything because I don't want to use my patients as guinea pigs. But once something new has come out and I see that it's a good thing, it's working, then I get on the bandwagon very early, like the front of it, if you can get a visual. Okay, so it looks like it is time for us to do Dr. Kvitko's question of the day, but before we do, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, today we are celebrating the fact that my dental office has won the Consumer's Choice Award for the last 10 years in a row. What are some of the reasons we think we continue to win? Is it A, we treat people like gold? B, we make sure that our patients are comfortable no matter what it takes? C, we provide our patients with top-notch care? Or D, all of the above? All right, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said people don't take the time. Hey, people don't down, take the time.
Hey, what's going on? It's Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. You can look for my smile courtesy of Dr. Kvitko on the CBS television network, where I play Danny on the hit soap opera The Bold and the Beautiful. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. Okay, we're back. We have Shu on the line. Hey, Shu, how are you? Hey, that rhymes, by the way. Shu, can you hear me?
Yes, I can hear you.
Okay, do you have the answer to Dr. Kvitko's question of the day?
Yes, all of the above.
All of the above is right. Shu, what do you do for a living?
I'm retired now.
Retired as a what?
Well, I worked for Lucent Technologies.
Lucent Technologies.
Yeah.
Oh, as some kind of a chemical engineer, was that paint?
No, it would be industrial engineer for telecommunications.
That's right, telecommunications. Okay. Well, you're retired, but you're still getting up early, huh?
Oh, yeah, I was up in the office and listening to the program.
Cool. Okay, well, hang on. We're going to get information where we can send those flowers from you. Thank you so much for tuning in and listening and calling. And tune in next week, too, okay?
Okay, thanks a lot.
You're very welcome. All right, if you're just joining us, I'm Dr. Kvitko. This is episode number 615 of The Reasons We Smile. Today we're celebrating the fact that Dr. Kvitko and Associates has won the Consumer's Choice Award for the last 10 years in a row. We're hoping that we can make that 11. And I want to say, we've talked a little bit about OSU football, and again, congratulate them on their win yesterday. But I know that Coach Urban Meyer used to say, and I know Coach Day does, he also says now that the best thing about being 10-0 is the chance to go 11-0. And so that's the way I look at it. Just because I'm 10-0 doesn't mean I'm guaranteed being 11-0, right? And so I have to work very hard every day. My staff has to work very hard every day to make sure that we continue to exceed expectations of the people that come to us, so that they are happily sending their friends and family. And that allows their friends and family to receive great care as well. And it allows us to grow. So another reason that we think that we may keep winning is because we mentioned sedation in the interview with Audrey Hassans on Daytime Columbus. But basically, the reality is we have a sedation option for everyone. We have a combination of either laughing gas or drugs, either IV or oral, that we know can get anyone and everyone through a very anxious or maybe scary dental appointment. And not every office does that. In fact, very few do. A lot offer oral sedation and laughing gas, but not very many can offer the intravenous like we do, and I've been doing that since 1985. We have a make it right policy. If something doesn't go exactly right, we're going to make it right. If a filling doesn't last as long as it should have, we'll make it right. If something chips or whatever it is, we just make it right. We don't charge extra, we just make it right. So the other thing that we think is cool, and one of the reasons that people have told us that they think is cool, is that we are a one-stop shop. I've spent hours and hours and hours receiving extra training on various procedures so that you don't have to go all over town to receive your dental care if you are a patient of mine at the dental office at Dr. Kvitko and Associates, okay? Because we do the placement of implants and restoring them. We do impacted wisdom teeth. We do the 6-month smiles, the orthodontics. We do the veneers, the complete smile makeovers, the root canals. See, people, when somebody comes in with a toothache, more likely than not, they need a root canal because their decay has reached the nerve. So in a lot of offices, that would mean you would be referred to an endodontist to have your root canal. And so you'd still, either the dentist that day would do some kind of a temporary procedure to try to get you out of pain, but it really doesn't work for more than a couple days. Or they wouldn't even try. They would say you need to go to the endodontist, and who knows how many days that might take before you get in. So when you do make your appointment at the endodontist, now you've got to work around their schedule. You have to work around their financial options and costs. And then you come back and to the general dentist after the root canal has been done. So now we're probably talking about 2 or 3 weeks has gone by. And all you have is a temporary filling. And then the general dentist is going to do what's called a crown buildup and prepare your tooth for a crown. But only 6% of dentists out there have the same day crown machine that we use. And so a 94% chance you're going to have to leave the office with a temporary crown because they've done an impression and sent it off, or scanned it and sent it off. And so now you're walking around with a piece of plastic that could come off. There's a famous segment with David Letterman. He was doing a show one night, and he was complaining about how he had a temporary crown come off, and he was just basically very, very upset at his dentist. Well, if we don't have to place a temporary crown, we don't have to worry about one coming off. And so anyway, and so then you'd come back 2 or 3 weeks, and you get the final crown cemented that the general dentist made. We're talking about 6 to 8 weeks to do that, okay, if you go elsewhere. If you come to us, that's done in about 2.5 hours. So we do the root canal, we do the crown buildup, we scan your tooth for the crown. And by the way, of that 2.5 hours, a good 30 minutes of it is you just sitting watching TV or reading a book or a magazine while you're waiting for your crown to bake, okay? Because it takes about 6 minutes to mill and about 15 minutes to bake, but there's a little bit of prep time before and after the baking, and so, like cooling, for example. And so, but 2.5 hours as opposed to 8 weeks, that's not bad. That's not bad. And it's actually cheaper because we're not charging endodontist fees, you know? So, and we don't charge extra because it's the same day. So we think that goes a long way to having people think that we're the place to be. Okay. Let's see. Another would be that we're very thorough. So our examination and x-ray appointment is at least an hour. If you're a new patient, we're going to set aside an hour and a half if you're also wanting your teeth cleaned that day. Because we know that we want to be thorough. You want us to be thorough. You don't want us to miss anything, right? You don't want to be told you're healthy when you're not. You don't want to be told you have 3 cavities when you have 6. You don't want to be told you have a cavity when you need a root canal. Or you don't want to be told that you're healthy when you may have a lump that could be cancerous, right? So we're very thorough. And I have had people come in and say, can I get the once-over exam, like the one-eye closed exam, because they just want to get in and out. And I'm like, well, no, can't do that. We don't do that. So we want to give you a thorough examination. Now, if you don't want to act on some of the information we've given you, that is certainly up to you. If you're not worried about the lump on your tongue, or you're not worried about the fact that your cavity is almost into the nerve and you're going to need a root canal soon, that really is up to you. You drive the bus. It's your mouth, your body. But I think you deserve to know what's going on, and we're going to do that. Okay, I have a few more things to go over when we come back. You're listening to The Reasons We Smile with Dr. Kvitko, episode number 615, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
Okay, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It's episode 615, and we're talking today, we're kind of celebrating the fact that my office has won the Consumer's Choice Award now for 10 years in a row for a solid decade. To me, that's pretty cool and maybe worth talking about, even though we don't normally make this show into an infomercial. In fact, we almost never do. A lot of the shows you hear out there, including on this station, are just people kind of, talking about themselves, and they kind of are infomercials, but we try to make ours not that, except for today. Okay, so another thing that we think is a reason that we have been winning and we hope to keep winning is, we treat people, we talked about how we treat people like gold, but we don't judge people. We're not going to judge you because you haven't been in 20 years anywhere. It doesn't matter what happened 20 years ago, right? You're here today. Let's deal with today. The other thing is we'll let family members in the room. We're not going to exclude people from, if they're worried or they just want to be in the room or their child wants them there. No problem. We just get you a chair and there you are. We don't act like we're more important than you. I hate it when I go to any business, but oftentimes it's those medical offices, right? Big sign at the desk, no cell phone use. It's like, you know what? I might need my cell phone. I might need to contact somebody. And these offices, they treat you like they're more important than you. We don't do that. Actually, for a while, I don't know if it's still up or not, it should be, we have a sign at our counter that says, feel free to use your cell phone all you want. As far as we can tell, it doesn't interfere with anything. And folks, I don't think it interferes with anything. Telling you that it's going to interfere with their sensitive equipment, I think that's a bunch of bull. So basically, we don't act like we're more important than you, because we're not. You're the most important thing in the office, right? Without you, we don't have an office. We have a bunch of technology that we can use to provide the best, most up-to-date care. That's pretty cool. We're very patient with our patients. We know you're nervous. We know that sometimes things come up. We know all kinds of things. And it's like, I went to a seminar the other day, and the guy was saying, you got 20 patients. He goes, 2 of those 20 patients are going to cause you 90% of your problems, so get rid of them. He literally was teaching people to get rid of those people. And I've learned otherwise. When people come in and they're maybe a little bit problematic at first, it's just because they're afraid, just because they're nervous. They don't know what to expect. And once we get them at ease, oh my goodness, they turn out to be our best patients. I would never dismiss a patient over, a little bit of a rough spot. So, okay. And I think that might be it, especially because I saw I'm out of time. I could probably say some more, but I won't. Okay, so like I said, that is all the time we have today. Don't forget to follow me on Twitter. It's at Dr. Kvitko. And visit my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye. And again, for my WQIO Super Q listeners, while the show is going to continue in Columbus, counting this one, there will only be 4 more episodes that air in your area. So I'm really sorry about that. If you've come to love the show and are going to miss it, you will still be able to access it at thereasonswesmile.com, as well as if you happen to be in Columbus on 94.7 FM. So today starts a 4-week countdown, episode number 615 today, and there will be 3 more episodes after this in 3 consecutive weeks, episodes number 616, 617, and the last one that will air in your area is 618.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262